Hello, my name is Victoria Rodriguez, and I'm a senior nursing student at Pacific Lutheran University. I had the privilege of doing my senior practicum at Seattle Children's Hospital in their Level 4 NICU. The title of my poster is NICU Nursing Care for the Neonate Experiencing Bronchopulmonary Dysplasia. In my poster, I refer to bronchopulmonary dysplasia as BPD, and I will for the rest of this video presentation. What sparked my interest about this topic was how prevalent this disease was at the Seattle Children's NICU. It was something that I had never heard of and I wanted to learn more about, and I also cared for a lot of infants with this, so I wanted to know the best interventions that we could provide for these infants. As I explored the literature, something that surprised me was how many risk factors can predispose an infant to BPD. For example, infants who are born premature, require mechanical ventilation, or oxygen supplementation are at increased risk of BPD. When I cared for patients with BPD, my preceptor and I were always very cognizant of the oxygen saturation target ranges, and if they went too high or too low, as soon as the alarm sounded, we were in the patient's room to fix it. I didn't understand the importance of this until I did more research on bronchopulmonary dysplasia and learned that if the oxygen saturation goes too high and causes hyperoxia, it can further contribute to the disease process of BPD and cause worsening of the disease process. If the oxygen saturation goes too low and it causes hypoxia, it can cause further tissue damage as well. So keeping that oxygen saturation range within a target window is really important for these kids. Something that helped to further my understanding of BPD was researching more about the pathophysiology of the disease process. It helped me to really understand more about why these kids present with certain signs and symptoms and what we can expect to see in them. If there were 2 to 3 things on my poster that I want people to take away, the first would be, I want people to have a better understanding of what BPD is. Specifically for NICU nurses, the pathophysiology is really important, just to understand why kids present with certain symptoms and the types of assessments and nursing interventions we should provide. The second thing I want people to take away are the important assessments that we need to do with these kids. Under my assessment column, you can see some of the important assessments include assessing for changes in breathing pattern, oxygenation status, arterial blood gases, fluid status, neurological status, and nutrition status. So I just really want people to take away the importance of assessing for these certain things because it's really important for the prevention and treatment of BPD. The third thing I want people to take away are the important interventions under my implementation column for BPD. A lot of the interventions for BPD surround keeping a patent airway or keeping, in other words, the airway clear so oxygenation and ventilation are optimal for these kids. So a lot of those interventions would be suctioning, doing position changes, chest physiotherapy, a lot of things like that. But another thing I really want to touch on that's important is that while there are a lot of great medications we can give for these kids, such as some of the ones I talked about, such as bronchodilators, systemic corticosteroids, diuretics, and caffeine citrate. It's important that we don't resort to these right away because as you can see in my evaluation section, a lot of these drugs can cause long-term health complications for these kids. So just trying to implement non-pharmacological interventions before pharmacological interventions is really important. When it comes to 1 to 2 questions that I think people may have about my topic, the first that I think people would ask often is, what are common signs and symptoms of BPD? So as you can see under my introduction section, I kind of talk about this. Signs and symptoms of BPD include wheezing, difficulty feeding or poor weight gain, increased work of breathing, and tachypnea or rapid breathing. So just keeping those in mind are really important when you're assessing infants to see if they may be at increased risk for BPD. A second question I think people may ask often is, how often is BPD fatal and why is it such a significant disease process, as well as what are the long-term health complications? I also address this under my introduction section. So as you can see, about 26% of BPD cases are fatal. Of the infants who do survive, about 20 to 30% experience long-term health complications, such as asthma-like symptoms, pulmonary hypertension, respiratory infections, upper airway symptoms and problems, and neurologic deficits. Overall, BPD is a really important and significant disease because in the US alone, annually, there's about 10,000 to 15,000 new cases of BPD. And infants who are born at less than 32 weeks, 77% of them will develop BPD. So this disease is something that's really important, especially for NICU nurses to be aware of and just understand more about so that we're able to assess and provide optimal nursing interventions. As far as acknowledgements, I would like to first say thank you to Emily Biggs. She was my preceptor at Seattle Children's Hospital, and she really helped support my learning and was patient with me as I learned new skills. I would also like to thank Carrie Park, who was my clinical advisor, who really helped me through my senior practicum process and was there to answer any questions that I had. Lastly, I'd like to thank Dana Zeichkin, who helped me develop a project and a poster that I'm really proud of. Overall, I just want to say thank you for watching my presentation and helping me to teach you more about it was really gratifying. Thank you.